It is my pleasure to introduce to you somebody that I have known for a long time, somebody whose hands and heart are truly in the same place. Please give a warm SAHM welcome to President-elect Greg Zimet.
Thank you so much. Let me repeat Michael's welcome to all of you for being here on the second day of the meeting. And as he indicated, for many of us, it's actually the third day, as SAHM offered this advocacy session, which began Tuesday afternoon with preparatory training and continued on Wednesday with visits to the Hill. So I participated in this, and for me, this was an amazing opportunity to learn more about advocacy. James Baumberger, Devin Miller, Jamie Pozlowski, and Ethan Jorgensen-Arp of the American Academy of Pediatrics, Krishna Upadhyay and the Advocacy Committee, and Ryan Norton and the SAHM staff all deserve our thanks for putting together what was really an exceptional experience, taking full advantage of this year's meeting in Washington, D.C. So I wonder if we could take a moment to thank them. In my talk today, I plan to focus on the importance of context in understanding adolescent health, which is nicely consistent with both the theme and the Gallagher lecture. But first, given the location of our meeting, I want to talk a bit about advocacy. In this case, specifically as public action to influence policy. The training experiences on Tuesday and Wednesday focused on this kind of advocacy. In many ways, though some of you might argue, I am an introvert. So engaging in public advocacy does not come naturally to me and is way, way outside of my comfort zone. However, I've come increasingly to appreciate the importance of developing advocacy skills. Public health policy, which can be influenced by effective advocacy, has an enormous impact on adolescent health. Just as a quick example, countries like Australia, Denmark, Austria, and the UK have national immunization policies that have ensured that a vast majority of their youth have received HPV vaccination, and they're therefore protected from later development of cervical and anal cancers. In the US, where public health vaccination policy varies hugely from state to state, and vaccine delivery is inefficiently conducted, less than 40% of 13 to 17-year-old girls and a little over 20% of boys have received 3 doses of HPV vaccine. Policy matters, politics matters, and advocacy matters. Being in Washington, D.C., it is nearly impossible to forget, even if we want to, that this is a profoundly important presidential election year in the U.S., the results of which will have powerful implications for adolescent health, including reproductive health. Furthermore, because the U.S. is a global power, U.S. domestic and foreign policies also have implications for health for adolescents, adults, and children throughout the world, with climate change and military actions being just 2 examples. The theme of this year's meeting is Youth in Context, Interactions Among Adolescents, Environments, and Healthcare. I really appreciate this expansive theme as it emphasizes the importance of considering adolescent and young adult health in the broader worlds of family, school, community, culture, and political systems. At the same time that we discover keys to health by diving into the minutiae of the genome and the neuron, we should not forget that unlocking genomic and neurophysiological puzzles is not nearly sufficient by itself to address the major health and safety concerns of adolescents and young adults, a point that Ron Dahl made in his Gallagher lecture. Neurophysiological development, as well as health and health behaviors, occur within the context of peers, family, schools, and healthcare providers, within the context of community and cultural norms and dictates, and perhaps most importantly, as previously noted, within the context of political and public health policy. All of these contexts strongly influence the health and well-being of adolescents throughout the world in ways that cannot be captured solely by research into genes and neurophysiology. As the great Gestalt psychologist Kurt Lewin argued, or Lewin as he was referred to in the United States, the whole is greater than and different from the sum of its parts. Just as advocacy matters, context matters, as illustrated by this image. So here we have the same slice of pizza, but this slice of pizza is going to be evaluated by us very differently, depending on the context in which it's presented. At the same time, without adequate understanding of contextual cues, information provided can be very confusing and difficult to reconcile. For instance, although my good friend Susan Rosenthal appears to be twice my height in this picture, it's actually not true, but is instead a function of a distorted context provided in this case by the Escher Museum in The Hague. This year's theme is very much reflective of SAHM's mission. So you bear with me, please, while I read our mission statement, which most presidential addresses do. Founded in 1968, the Society for Adolescent Health and Medicine is a multidisciplinary organization committed to improving the physical and psychosocial health and well-being of all adolescents through advocacy, clinical care, health promotion, health service delivery, professional development, and research. Like Youth in Context, we who belong to SAHM and attend this meeting are professionals in context. We rely on the youth we work with, advocate for, educate, and study to inspire us and energize us. We rely on our own teachers and mentors to guide us, and rely on our colleagues, our mentees, and the SAHM community to support our efforts. We rely on our institutions and our local, state, and national governments, or at least hope to support our clinical and educational activities, listen and respond to our advocacy efforts, and fund our research. Our families and friends help to remind us of some of the most important priorities of our lives, which exist outside of our political endeavors. We represent great diversity in terms of discipline, nationality, race, ethnicity, age, and stage of career, to name just a few characteristics. My hope is that the diversity and therefore the strength of SAHM only increases over the years to come. Amid this diversity, however, there are at least two commonalities. One, as you all know, we're all here and part of this organization because of our commitment to adolescent health. And two, a fact we should never forget and isn't really discussed enough, we all have been adolescents ourselves, and we should never forget that. The meeting this year is in Washington, D.C., the capital of the United States. As I mentioned before, decisions made in this city impact for better or worse the health and well-being of adolescents and young adults throughout the United States and the world. Though Washington, D.C. is a seat of power in the United States, in some ways it mirrors issues faced by young people throughout the world. Like many adolescents and young adults, the people who live in the U.S. Capitol, many of whom live in poverty, are excluded from the decisions that profoundly affect them. As the Washington Post noted in 2013, the district is the only place in the United States where citizens pay federal income tax and fulfill obligations such as military service, but are denied a true voice in the federal government. The district has a representative in the House who is not permitted to vote, and it has no representative in the Senate. Similarly, adolescents are often a disenfranchised group who have little input into decisions that impact their well-being. I am really proud, therefore, to belong to an organization like SAHM that is inclusive, not exclusive, and that fights for the health of all adolescents and young adults, and for adolescents having a voice in the decisions that affect their lives. At our meetings, we often have sessions in which young people are included and given the opportunity to educate us about their experiences and challenges they face. Many researchers who are members of SAHM include adolescent voices and perspectives in their community-involved research through adolescent community advisory boards and focus groups. A colleague of mine from University of Adelaide in South Australia, Helen Marshall, has used a unique methodology called citizens' juries to elicit adolescents' perspectives on health policy decisions that affect them. These are only some of the ways that we, as adolescent health professionals and members of SAHM, ensure that the voices of adolescents and young adults are an integral part of all that we do. As I think about youth in context, I would like to talk briefly about my hopes for SAHM over the next year. To start with, I think it's valuable, and you'll have to bear with me with this, to review our organization's vision and value statements. And the reason I'm doing this is because if you're like me, you actually haven't gone to the website to read our vision and value statement. I'm not blaming anyone for that, but there'll be a test after the lecture. So, our vision statement reads, "A society for adolescent health and medicine will be the leader," and it's italicized, "in promoting optimal health and well-being for adolescents and young adults." There are 4 core values that underlie SAHM's mission and vision. The first is excellence. SAHM strives to achieve the highest attainable standard in its mission. The second, which I want to focus on particularly, is leadership. SAHM strives to be the preeminent organization and authoritative voice in advancing adolescent health by increasing awareness of the health needs of adolescents and young adults through effective advocacy, communication, and dissemination of knowledge. The third is integrity. SAHM is guided by the highest ideals and ethical standards, including respect for individuals, dignity, equity, justice, and recognition that age-appropriate, developmentally sensitive healthcare is a right and not a privilege. The fourth and final value listed is collaboration. SAHM recognizes that advancing adolescent health depends on effective partnerships among adolescents, families, health professionals, public and private sectors, communities, schools, and other social institutions. The words leader and leadership are prominent in our vision and value statements. Part of being the leader means taking the lead in publicly endorsing policies that enhance the health of adolescents and opposing policies that undermine adolescent health. Being the leader also means doing this in a timely fashion so other organizations recognize our expertise and leadership. We need a rapid response mechanism to address important policy changes. An example of this might be the 2011 addition of males to the ACIP's routine recommendation of HPV vaccination in the United States, or it might conversely be a reaction or a response to efforts to restrict adolescent reproductive health care. Over the past year, during Michael Resnick's presidency, we began an effort to put in place guidelines for a rapid dissemination of SAHM positions on timely topics. During my year as president, I really plan to continue this effort so that we can most effectively fulfill our mission in a way that reflects our vision and values. You can already see the results of our initial efforts on the SAHM webpage, the homepage under SAHM News, with announcements of a letter to the governor of South Dakota urging a veto of a bill undermining the rights of trans and gender nonconforming youth, and a statement. And there's, which is great, and you'll want to clap again in a minute because there's really even more good news about that. And a statement supporting CDC's recommendation of the 9-valent HPV vaccine. I'm really pleased, I can't tell you how pleased I am to report that the South Dakota governor, Dennis Dugard, did in fact veto the bill. Perhaps, I'd like to think, in part due to the SAHM's letter. So I'd like to take a moment to acknowledge the important context of my own life. I am very deeply honored and grateful to serve as president of SAHM, an organization that has been my professional home for well over 20 years. Contextually, since context is the theme, I have the privilege of following 2 wonderful leaders, Carol Ford and Michael Resnick, and to be followed in turn by another dynamic leader, Tamara Coyne-Beasley. SAHM presidents and board members work in the context of the superb support provided by our management group from Kellen Association Management, including Vicki Louisi, Ryan Norton, Melissa Schwedel, Justin Dreyfus, Lynn Maddox, Elizabeth Oceanson, and Kim Santos. Yes. I first came to SAHM when I worked for Trina Anglin in the late 1980s in her division of adolescent medicine in Cleveland, Ohio. Subsequently, I moved to Don Orr's division in Indianapolis in 1993. Once Don retired, Vaughn Rickert served as our division chief. On Vaughn's untimely death last June, Dennis Fortenberry stepped in and has guided us through a very difficult time. I owe all of these leaders in adolescent health a great deal. They are and were my colleagues, my friends, and my mentors. In Cleveland, in Indianapolis, and at SAHM, I have been surrounded by extraordinary colleagues who have become extraordinary friends. Through my research, I've had the opportunity to collaborate with colleagues across the United States as well as throughout the world, which has expanded my understanding of the impact of policy, culture, and context on adolescent health. As Mark Twain famously said, travel is fatal to prejudice, bigotry, and narrow-mindedness, and many of our people need it sorely on these accounts. Broad, wholesome, charitable views cannot be acquired by vegetating in one little corner of the earth all of one's lifetime. I would add that this is only true if one travels with an open mind. Travel can be seen not just as journeys across physical space, but also as journeys of the life and mind across time. When I started graduate school in psychology, I was particularly interested in the role that rites of passage played in helping individuals adapt to life transitions. For my master's thesis, I, perhaps mistakenly, because my committee wasn't pleased, but I drew on research from anthropology, psychology, and narrative analysis, as well as from an in-depth analysis of Shakespeare's King Lear. I was very interdisciplinary within myself. But King Lear is my favorite play, and it's a play that explores, in part, the psychological experiences associated with traumatic life change. I applied this information to a research project focused on factors that enhanced or mitigated stress associated with entry into law school. Part of my joy in writing my thesis, and I really enjoyed writing this, but I didn't enjoy my oral exam, was that this exploration across disciplines of how context matters, I really enjoyed that, particularly during transitions. So that was a long time ago. If we fast forward 35 years, my current research interest is not restricted to, but is primarily vaccination. Superficially, rites of passage and vaccination seem light years apart. However, just as rites of passage and life transitions cannot be understood without considering contextual factors, vaccination decisions occur within a complex array of historical, personal, ethical, cultural, economic, political, and policy issues, as illustrated in this model of immunization systems in Uganda. I don't expect the test will not cover this model. But really, my point in showing this is, in fact, the complexity of this. And this is specific to Uganda, but these kinds of issues really apply everywhere. You would just fill in the details a little differently. So clearly, it's virtually impossible to fully capture such multi-level contextual complexity in any single research study, advocacy message, or clinical discussion. However, as we engage in our research, our teaching, our advocacy, and our clinical work, it is essential that we keep in mind the bigger contextual picture behind the specific issues we focus on. Otherwise, we may not know that we're looking at an elephant. In closing, I want to acknowledge the most important context of my life, my friends, and my family. Ultimately, with nearly everything we do in our lives, including our work with adolescents, context matters. Thank you.